From the studios of Tucson Business RadioX, recorded in the Stewart Title corporate offices on Broadway, you are now listening to The Mark Bishop Show. And now here's your host, Mark Bishop.
And welcome to another Mark Bishop Show. My special guest today is Doug Olson, MD, Chief Medical Officer, Medicaid and CHIP, which is Centers for Medicare and Medicaid Services. Welcome, Doctor.
Thanks, Mark. A pleasure to be with you today.
Well, a student's health and academic success go hand in hand. While school may look different this year, and not everyone will be in a physical classroom, having health insurance remains vital for young students to fully engage in academics, online and in person. Now, Dr. Olson, studies have shown that children with health coverage, they're less likely to miss school due to illness, and they're better prepared to learn, also resulting in fewer missed days of work for parents. That is so, correct?
All of that is correct.
So, for uninsured kids in families with limited incomes, Medicaid and the Children's Health Insurance Program, CHIP, offer eligible children and teens up to the age of 19 access to routine and emergency care, eye exams, dental visits, mental health visits, prescriptions, and other care that improves their ability to fully participate in classroom and, importantly, after-school activities. Now, whether that's in person or virtual. Eligibility is dependent on the household size and income, and it varies by state. But on the average, a family of four earning up to $50,000 a year or more may qualify for Medicaid or CHIP. So please explain, if you would, from there, Dr. Olson, for us.
Absolutely. Medicaid, like you said, Medicaid and CHIP covers kids up to age 19, dependent on household size and household income. And for those that qualify, they have ready access to a whole host of medical, behavioral health, oral health, and preventive services. And, that includes vaccines. And, unfortunately, when kids do get sick and they need emergency treatment, it covers that as well.
Yes, and over the last few months, many families may have postponed medical appointments due to COVID-19. The start of the school year provides a good opportunity to catch up on important well-child visits and ensure children are up to date on their immunizations. Correct, Doctor?
Correct. One of the great things about CHIP and Medicaid is that people can enroll year-round. So there's no special enrollment period. And the start of the school year provides a little bit more urgency than the rest of the year, though, for people to get needed medical care. And certainly before the coronavirus, there was a need for school physicals and updated vaccinations, mental health screening, treatment, and, of course, oral health care. And, with the gaps in care that have happened over the past 4 to 6 months, it provides even more impetus to make sure that those gaps in care are addressed and kids are back on the path to health.
Doctor, let's talk about the eligibility. Is it stringent? We talk about the $50,000 a year. Well, what are the parameters there? What are the guidelines?
That really is state specific. And so, without getting into a lot of details, it really is, and by a lot of details, I mean actual dollar numbers per people per household. It really is for people who are low to moderate income, and that's in all 50 states, certainly, including Arizona. And the easiest way for a family or caregiver to find out if their kids can enroll in Medicaid or CHIP is really to, be proactive about it, reach out, and get those details for themselves, because they may not qualify right now, but as we know, life can change on a dime, and they may qualify 2 or 3 months from now. So, the best way to do that really is, if people like to pick up the phone and call 877-KIDS-NOW. Really easy to remember, 877-KIDS-NOW. Or, if people are sitting and they have a little bit of downtime and they've got their smartphone in their hand, they can go to insurekidsnow.gov. Again, sort of insure, INSURE, insurekidsnow.gov, and get those fine details based on, their specific situation. Because, as we know, though healthcare is applied across the country and to everybody, it's really everybody's individual specific circumstances that makes it meaningful for them.
Right. And what about vaccinations, Doctor?
So under Medicaid and CHIP, again, for kids up to age 19, vaccinations are covered. All of the routine vaccinations that we all know and we grew up with, so whether that's the MMR, measles, mumps, or rubella, polio, certainly influenza vaccine, all the routine vaccinations are covered. And, of course, I've only listed a small number, knowing full well that you can either prevent or eliminate up to 14 different diseases based on vaccines.
Yeah.
And all of those are included in coverage.
How does health overall, do you think, affect a student's academic performance?
I really like to look at it through the lens of, the oral health care, the behavioral health care, and the physical health care. And when all of those are taken care of best, kids are pain-free, they're healthy, they are progressing along all of the milestones of childhood, and they can engage in life most actively. And, so much of growth and development occurs outside of the classroom, and so engaging in that fully is so important. But then, of course, inside the classroom, whether it's brick and mortar or virtual, the more a student can absorb in terms of knowledge and lifelong learning, the better they're going to be as adults for a very long time.
Well, it's quite obvious then, Doctor, that it is very important for students to have health coverage. And, but why right now? Why should families enroll right now?
A couple of reasons why people should probably enroll right now. So if they're not enrolled and they qualify, right now is important because we're going back to school. Some school districts, in fact, most school districts do require some sort of annual physical. They require some sort of vaccination record to make sure that kids are safe in school and, again, can maximally participate in what's being offered. And, at the same time, with the coronavirus pandemic going on, if kids do have the opportunity to get vaccinated at no cost and really protect their own family by not getting sick with the flu and, eventually other vaccines that are in development, then that benefits both a family and the community well beyond the actual child. And doing it now is great because it's something that parents, caregivers can do for their kids to keep them healthy. And keeping people healthy is always the best thing to do.
Overall, my word, and you took the words right out of my mouth. I was going to ask you why should children get vaccinated against, seasonal flu. That's a good time to do that one right now. How can families with eligible children enroll in the coverage?
To take that first step and make sure that they can enroll, it's really, again, picking up the phone or going to that website. And, of course, you can do the same thing on most smartphones these days. But just to provide those resources again, the phone number would be 877-KIDS-NOW, and the website would be insurekidsnow.gov. And once a family or somebody goes through that process, it's really easy, 5, 10, 15 minutes, usually connecting with a live person, figuring out if they qualify based on their individual circumstances, and then, providing some readily accessible documentation to support that, and then coverage will be given.
That's it. It's pretty simple, really. Is there an enrollment, an enrollment period for these programs?
I love that question because That answer is the same 365 days a year. So the enrollment period is now. And what I mean by that clearly is there is no enrollment period. Whenever somebody qualifies for CHIP, and certainly for all kids up to the age of 19, they can enroll at any time, unlike some other healthcare insurances.
Well, that's fantastic. Well, I'll make sure this will go up onto the Tucson Business Radio X site on the Business Radio X network, and those addresses and phone numbers will stay there permanently for people. So 1-877-KIDS-NOW or insurekidsnow.gov. And often it's good to go to a site. You know, you can read a lot more and just get a better feel for things before you actually do call and prepare yourself a little.
Agreed.
That's fabulous. All right, you're doing a great job, Dr. Olson. Thank you for your time today. Dr. Doug Olson, folks, he's Chief Medical Officer at the Center for Medicaid and CHIP Services at the Centers for Medicare and Medicare Services, CMS. And he works to advance value, quality, and equity in Medicaid and CHIP, and supporting CMS's mission to improve the health of programs to 73.5 million beneficiaries. Great job, Dr. Olson. Thank you for your time.
Mark, thanks for having me. Bye-bye.
Goodbye.